All right, good morning, everybody. Today we are going to talk all about muscles and their functions. So last class we reviewed just kind of what muscles we have and where are they in relation to the horse's body and what different bones are they connecting. So today we're going to talk a little bit more about how they work together and then the joints that they move. So for today, I want you guys to be able to, again, kind of review and identify those key muscles that were on your list, and then understand which bones as well as joints that these muscles are actually moving and responsible for. And then I want you to be able to understand how these muscles all work together or how they oppose each other to produce this coordination and movement that our horses have. So first, I want to talk about some of the different directions of movement. So as a review, if you guys remember, we have flexion is going to be involving flexor muscles that are going to be pulling a bone backwards, or more simply, bending a joint. So again, here we have a nice drawing of flexion of the stifle and the hock and the fetlock, where you can see now we have these kind of 90-degree angles. Again, another picture just of our skeleton of our horse's forelimb, of the carpus flexed, the fetlock flexed, and that pastern and coffin bone all in that flexed position. So again, in this case, we're relying on these muscles that are usually going to be at the same side of the direction that that joint is bending towards, that we call our flexors. Whereas the opposite of that, we have our extensor muscles that are going to be pulling a bone forward, or essentially straightening out the joint. So again, here, usually our extensors are going to be on the front of the limb, or basically acting kind of against that joint to straighten it back out. So in our horse's legs, though, when our horse's legs are considered straight or extended, that's usually when they're actually kind of moving their lower limb out forward, where everything's all in alignment. Whereas when our horses are actually just standing on their limbs, their lower limb in that below the fetlock joints, their pastern and coffin, are actually considered hyper extended, since we're not just in one straight line. But essentially, throughout the body, we're going to have one or more muscles that are going to be essentially kind of working in pairs or having opposing groups of muscles. So when one muscle is contracting, especially in the case of like flexing a joint, all of the other muscles are going to be relaxing or stretching or helping to stabilize that joint. All right, so first let's talk a little bit about the movement of the head and neck. So one thing that is important is to note that while most of the muscles that we are going to be talking about are usually connecting a bone to a bone, we also have some muscles that are going to attach through ligaments. So really important ligaments that we have are the neutral ligament, that's going to start at the pole and then run all the way down, and then also have some connections to our vertebra. And then we have our supraspinous ligament, which is going to be above all of those spinous processes on our vertebra. Okay, so in our head and neck, we should remember some of these muscles from when we went over them last class. But essentially, we have our main muscle that's going to be extending and lifting the head or neck, and then also responsible for side to side movement, which is going to be our splenius muscle right here, or shown here attaching to the cervical vertebra. We also have our rhomboid that's going to be on top of that, that's going to also assist a little bit with extending and lifting the head or neck, but mainly is there to be a stabilizing muscle, just again supporting the weight of our horse's head. And then on the opposite end, we have that sternomandibular muscle. It's on like the very lower part of the neck, kind of right underneath that jugular groove or jugular vein. And that is what is going to help our horse's head flex, as well as lowering of the entire head and neck. So again, when looking at this just on our normal horse, our splenius muscle is going to be around here. It's again going to help lift that head and neck up and also be responsible for side to side motion. We then have our rhomboid that's going to come all the way up kind of along the crest of our horse's neck. And again, going to help stabilize. It also might aid in moving that scapula forward and helping move our forelimb forward. And then under here, our throat latch area, and then everything under that nice jugular groove is all going to be that sternomandibular muscle that's responsible for flexing and lowering the head and neck. So next muscles that we're going to talk about are mostly involved in moving the forelimb. So in talking about our shoulder, remember that our shoulder in our horses and our scapula is not attached by any bones. So we have a lot of musculature that's both stabilizing it as well as helping to move it forward. So first we can talk about our brachiocephalic muscle, which is right here in the neck. That's going to extend from the skull all the way down to the shoulder joint. And essentially it's going to also aid that splenius muscle and some of the side-to-side movement of the neck, but it is also going to be extending and pulling that shoulder joint forward. That way we move our entire forelimb forward. The opposing muscle to that is going to be our latissimus dorsi muscle right here, which, as you can see from this diagram, is actually going to attach down at the humerus. So this is going to draw the forelimb backwards by adding flexion into that shoulder joint. So it's a little bit backwards. We're flexing the joint, but we're actually pulling it backwards for our latissimus dorsi. But then when we are extending the shoulder joint, we're moving our forelimb forward for the brachiocephalic muscle. So an interesting thing about the latissimus dorsi, obviously we have this large muscle that's attaching to the humerus and then up to our horse's back. But once we get up to our horse's spinal column, all of this tissue is changing from muscle and now becoming what we call the thoracocolumnar fascia. So the thoracocolumnar fascia is a strong connective tissue layer that essentially is going to help support and stabilize the horse's back. And then its main function is going to be to help transfer some of the force and power that's going to be coming from the hind end to the spine and that forelimb during movement. All right, so a few more muscles that we're going to add into our shoulder here. We have our cervical trapezius and our thoracic trapezius that are going to help just stabilize that scapula and shoulder, along with our brachiocephalic and our latissimus dorsi, especially when these muscles are moving. And then we have two other muscles that are going to be right over the scapula. One is going to be cranial to our scapular spine, which is going to be our supraspinatus muscle. And this one, again, is going to attach from the scapula to the humerus, and it's going to help extend that shoulder joint and move that limb forward. Whereas on the other side, our more caudal aspect is going to be our infraspinatus, which is going to do the opposite of that and actually flex that shoulder joint, so decrease the angle, which is going to cause our leg to move backwards and also slightly outward as well. That way that horse can clear the rest of its body when it's moving that shoulder out. So again, putting all of these together, we have our brachiocephalic muscle, which is running right here. And then it's going to again come all the way down to our attached to the scapula and the humerus, that shoulder joint, as well as the supraspinatus that's going to go right over the scapula, which the supraspinatus and spinatus are pretty deep muscles. So usually we don't actually see them externally. What we're probably seeing here is the deltoid. However, these two are going to work together to move that forelimb forward and extend the shoulder and move this whole limb up. Whereas that cervical trapezius is going to help kind of stabilize that scapula. And then on the other hand, our latissimus dorsi, that again is coming all the way down here, connecting to the humerus, as well as our infraspinatus, which is going to be going right along our scapula, are both going to be flexing and contracting to decrease that shoulder angle and moving our forelimb and the humerus backwards. While again, our thoracic trapezius is going to help stabilize that shoulder during movement. So one thing people talk about a lot, especially with our riding horses, is the, kind of the shape of the horse's neck, the muscling of the horse's neck can tell you a lot about either how it's being ridden. Although I will put a disclaimer that a lot of the shapes and differences in our horse's neck in musculature is obviously going to have to do with some of their breeding, their genetics, their general conformation, and their overall fitness. But we tend to see when horses are going against the contact or against the bridle, we are going to see kind of an increase in development of that brachiocephalic muscle or that lower neck muscle here. And then another picture here. Whereas if our horses are hyperflexed, so meaning usually being a little bit behind the vertical and like overextended over their neck, sometimes we see a little bit of overdevelopment of that splenius muscle. And then we might also see things like hypertrophy or overmuscling of that rhomboid, as well as, again, here's some of that brachiocephalic muscle that's connecting to the jaw that's being overdeveloped. There are some parotid salivary glands that are also here. So sometimes if you see that bulging, it could be, again, due to improper use of the horse's neck muscles, or it could be potentially something going on with their salivary glands. But either way, these are kind of abnormal developments here. Again, this picture is kind of a nice example of what an ideal neck would look like, where we obviously have nice developed musculature, but it's fairly even throughout each of our different types of muscling. All right, so still within our shoulder, we have some additional muscles. Like I said, our most superficial is the one that we're going to kind of be able to just see on our horse when we're looking at them is going to be that deltoid muscle. And that deltoid is going to also assist in flexing that shoulder joint, as well as moving that shoulder away from the body midline so that again, that forearm can kind of clear the body and it doesn't just all get trapped up together. And then we also have our pectoral muscles. And when you guys go and eat brisket, like from a cow, essentially you're eating their pectoral muscles or these chest muscles. But there's 4 different groups. I don't need you guys to know all these individual groups. I just want you to know that these are the pectoral muscles. And essentially they're going to work opposite of the deltoid and actually help move that forelimb back towards the middle of the body when that horse's leg is going out and then coming back in during movement. So when we look at our horse, especially our horses that are very well muscled, like these are all quarter horses here, it's really obvious to see some of the pectoral muscles. So the first grouping is going to be that subclavian, which is in pairs. Our next is going to be that descending muscle, and that's kind of the 2 prominent muscles that we think of as those chest muscles. And then our transverse muscles are going to be right below those. And then finally, the ascending pectorals are going to be seen both ventrally, or you can see them from the side, kind of right behind the elbow there. Again, all work together to kind of bring the legs back towards the body during movement. So now we are moving into our elbow. So in our elbow, we have our triceps. Our triceps is called the triceps because essentially it has 3 different heads. I don't need you to remember that, but just know that that's where the term triceps come from. But essentially all of these are going to work together to extend the elbow and flex the shoulder. So essentially they're going to be pulling the limb backwards or retracting the forelimb. Whereas our biceps, which again, usually we're not going to just be able to see on our horse. Sometimes we can, but they tend to be a little bit deeper in musculature. So sometimes that brachiocephalic muscle will cover them up. But essentially, our biceps brachii are going to act on 2 joints. So they're both going to flex the elbow here, and then they're also going to be extending the shoulder. So their main goal of the biceps is to just lift and extend that whole entire forelimb forward, whereas our triceps is, again, pulling on the ulna here on our horse's front leg and then pulling that limb backwards. So again, our biceps brachii are going to be here, wanting to moving the forelimb forward, whereas our triceps we can all see really easily just on our horse, and they are going to be pulling that forelimb backwards. Okay, now moving into the lower part of our front limb. So there's a lot happening right here. For the most part, I just want you to remember that we have a radial carpal extensor, which are going to be going all along the dorsal aspect of that horse's front leg, and essentially going to be attaching from, again, that scapula from the humerus and then connecting to the knee. And their main job is going to be a little bit to flex the elbow, but mainly to extend that knee and bring that entire forelimb forward. Whereas on the other hand, we have the lateral ulnar muscle, the radial carpal muscle, and the ulnar carpal flexor muscle. But these, I don't need you to know the individual ones. I just want you to know that these are the carpal flexors, and their job is to flex that knee and bring that leg backwards. So again, this is a great example of those flexor muscles being used to cause flexion in that knee. So we keep going down. We have, again, 2 extensor and 2 flexor muscles. Essentially, our extensor's goal is to lift the toe and kind of extend that leg out. Our common digital extensor is going to extend, as you can see, it comes all the way down, so it's going to extend everything, whereas our lateral digital extensor is going to come until about our second phalange or our short pastern here, kind of extending more of that fetlock and pastern joint. Meanwhile, our superficial digital flexor and our deep digital flexor tendons are going to be running down the back part of our horse's leg, or since we're in our front leg, our palmar portions. And these are going to be what's curling the toe back, or again, creating this lovely flexed position in our fetlock joint, our pastern joint, and our coffin joint here. So our superficial digital is going to, again, be flexing that fetlock and pastern, whereas our deep digital flexor is going to connect all the way down to our coffin bone to help curl in that toe and retract that and flex that forearm. So quick review because it's a lot. So our extensors are going to be lifting the toe and helping to extend, and they're going to come kind of lateral to the front or go right down the front and pulling everything out. Whereas our flexors are all going to be going down that palmar aspect of our horse's leg and flexing and bringing everything back. So again, when we're just looking at our horses, we can see some of these muscles defined. So up here we have our radial carpal extensor that's again get attached just to the carpus. We have our common digital extensor, which will run all the way down the dorsal aspect of our horse's leg and then connect at the coffin bone. And then we have our lateral ulnar muscle here that's on the side. We can see these same muscles on this horse here that's now in a flexed position. So again, this one helping to flex the knee. This one is actually going all the way, or sorry, these two are going to be relaxed while our knee is flexed, whereas this one is going to be helping to flex the knee. And then you can also see that radiocarpal flexor here on the inside of our horse's leg. Okay, so now that we've gone through our forelimb, let's talk about our hind limb movements and how these muscles work together. So looking at the hip of our horse, we are going to have our gluteals. Again, I want you guys for this class to kind of think as our gluteal muscles collectively, but also be aware that these are actually 3 different muscles that are making up this group of muscles. So again, we have our gluteals that are going to be this top portion of our horse that is going to be connecting from the pelvis, the sacrum, to the femur. But essentially, their goal is going to be to extend that hip. Meanwhile, we also have our opposing muscle, which is our iliopsoas complex. Again, this is going to technically made up of 3 different muscles, but as long as you know iliopsoas, that's all we need to know here. And it is going to be, again, having that opposing action of flexing that hip, specifically at that kind of lumbar sacral junction. So now moving into our stifle, we are going to have our quadriceps, which are here or here, again called quadriceps because it's a group of 4 muscles working together. And their main goal is going to be to extend that stifle and hock and flex and adduct that hip, all of which is going to bring that hind limb forward. Additionally, we have our tensor muscle that's going to be kind of right in front of it or over it if we're looking superficially. And this tensor muscle, which is right here, is going to be attached at the femur via something called the fascia lata. So a lot of times we'll call it the tensor fascia lata. And that is also going to aid in extending that stifle and hock and bringing that hind limb forward. So our opposing muscles that are going to be responsible for helping to move that stifle and move the lower part of our hind limb is going to be our hamstrings. Our hamstrings are made up of 3 different muscles, which are the biceps femoris, the semitendinosus, and the semimembranosus. But all of these are going to act to flex that stifle or decrease that stifle angle. And this is really what's going to be responsible for all of that, like pushing off and thrust movement to get our horses that power and energy that's coming from their hind end. And it's essentially going to extend kind of this whole hip area. So again, looking at our horse, when our horses have nice muscling in their hindquarters, we can see some of the differences. That main muscle we're going to see if we just lift up our horse's tail is going to be that semimembranosus. The next one, moving more laterally, is going to be, semimembranosus, then semitendinosus here, right here. And then the most outer or lateral muscle that we're going to see looking at our horse from the hind is going to be that biceps femoris, all of which are making up our hamstrings. Again, if we were to look at a horse just from the side, we would see this biceps femoris here, and then that semitendinosus muscle running all the way down the back of that hindquarter. or here and here. All right, so let's kind of put all of these all together. When our horse is in the swing phase, or that leg is being, moving up in the air, moving forward, our iliopsoas is going to be flexing that hip to help bring the hind limb forward, along with that tensor fascia lata. All of these muscles in here are, again, bringing our hind limb forward, allowing for that swing. Our horse is then going to land and go back into kind of that stance or neutral position, in which case, when we want that propulsion, we're going to have those hamstring muscles that are running down the back of our horse's hindquarters, extending the hip backwards, and then allowing that propulsion and propulsion, allowing them to propel forward. Ooh, it's a lot of alliteration. And then we have our gluteals here that are going to be aiding again in extending that hip. And then finally, we have our quadriceps that are going to be helping with extending the stifle. So our iliopsoas and our tensor fascia lata are going to be flexing that hip to move it forward. And then we have our hamstrings, our gluteals, and our quadriceps that are extending the hip and stifle so that it can then push off from the ground and move forward. All right, so now we are in our hock and our lower extremity for our hind limb. You're going to notice that there are some things about our muscles here that are going to be a little bit similar to our muscles on our front leg. However, we have a little bit of differences due to the hock, and then also some differences in naming. But essentially, first we have our gastrocnemius, or again, for us, this is the equivalent of our calf muscle. This is going to be connecting from the femur down to the calcaneus portion of the hock, and it's going to be connected through the Achilles tendon. And again, this is all going to really help with extending the hock and propelling that horse forward. We also are going to have our superficial digital flexor tendon that is going to start up at the femur and then run all the way plantar down our horse's leg. And it's really going to help with the gastrocnemius a little bit with extending the hock, but really with flexing the fetlock. So again, a little bit backwards here because we're extending one joint and flexing the other. And then we have our deep digital flexor tendon. Again, this is looking from the back of the horse's leg, running all down that plantar aspect. And this is going to be responsible mainly for flexing that fetlock, pastern, and coffin, which is where it is going to insert. So those were all our flexors. And now we have our extensors. They're going to run down the dorsal aspect of our horse's hind legs. So we have our long digital extensor, which again is going to go all the way down to the coffin joint, and it is going to flex the hock, but then extend the fetlock, pastern, and coffin. Whereas our lateral digital extensor, again, is going to come down and end at our middle phalanx, and it is going to extend the fetlock joint while bringing that hind limb forward. All right, so putting all of this together again. In that swing phase is where we have a lot of our use from our extensors. So we are going to have that long digital extensor is going to be flexing the hock, but extending that pastern, fetlock, and coffin joint, along with our lateral digital extensor that's also going to help extend that fetlock, and then together they are all flexing the hock and then extending that toe out. Meanwhile, we have that gastrocnemius gastrocnemius, or again, that calf muscle that's going to help extend the hock, allowing for that push off and propulsion forward. And then we have our superficial and deep digital flexor tendons that are going to be running down that plantar aspect of our horse's leg that are going to be responsible for flexing the fetlock and the pastern in the case of the superficial, and flexing the fetlock, pastern, and coffin in the case of the deep digital flexor muscle. And again, we're going to talk more specifically about how these are all going to become then those tendons in the lower legs that are really going to provide kind of that elastic band of where they can store up all of that energy to then push off and move forward. So last, we're going to talk a little bit about the movement of the spine and the trunk area of the horse's body. So along our horse's spine, the largest muscle in our horse's body is going to be that longissimus dorsi. So again, it's going to extend all the way around that back. It's going to also help aid a little bit in raising and extending of the head, but its main goal is going to be to kind of stabilize that vertebral column and support the posture of the horse's back, while also transmitting all of the force from that hind end that's being created up to the forelimbs. All right, so opposing our longissimus dorsi is going to be the abdominal muscles. So again, for our purpose, I just want you to know that the abdominal muscles are going to be on kind of the ventral and a little bit of the lateral side of our horse's trunk. But essentially, our abdominal muscles are actually going to be the ones that are contracting, that flexes the spine, while that longissimus dorsi relaxes to get that nice rounded back. And then obviously some of our oblique muscles are also going to help the ribs move out and in to help with exhaling. So again, like I said, we kind of have this ring, what we call of muscles that are all kind of working together. So we have that longissimus dorsi, we have that iliopsoas. I always want to pronounce the P. Iliopsoas complex, along with all of our abdominals kind of on our more ventral side there. So this is our horse in a neutral position here. All of our muscles are relaxed. However, when our horse is in an extended position, all of the muscles along the dorsal aspect, so that longissimus dorsi, are all going to be contracting and shortened, again, to help lift that head and neck up, whereas all of the abdominal muscles are going to be stretching. Whereas when the torso is flexed, all of these muscles above that vertebral column are going to be nice and stretched and lengthened, allowing that kind of rounding shape of the horse's back. Whereas the abdominal muscles are actually the ones that are going to be contracting, kind of shortening the length of that underside of their body. Whereas some people might think it's the opposite, that if our horses have nice rounded back, it's because those muscles in their back are tense, which is actually quite the opposite. So again, we've talked about before, when we were talking about our skeletal system, how our horse's spine is obviously not one of the most mobile aspects of our horse. However, we're going to have the most mobility in our horse's neck in those cervical vertebrae, which can pretty much bend all the way around. Looking at the rest of our vertebra, we're then going to have the next most movement in those lumbar vertebra. Again, this area we're not attached to any other structures here. Whereas obviously our sacrum are fused and we have our pelvis, and then our thoracic vertebrae are connected to our ribs that are kind of minimizing some of the movement of those joints there. Again, we just talked about how our horses can have that flexion and extended in their head and neck. That's also going to influence the roundness or hollowness of their back and which muscles are involved. And then we can also have some rotation in that spine as well, which is going to be especially useful when we're doing some of our more advanced dressage maneuvers. So one example of that is our haunches in, where horses are actually on 3 different tracks, having their hindquarters be moving separately from their shoulder.